Hello, my name is Mandy Daly, and today we're going to talk about skin-to-skin care. Kangaroo mother care is defined as the early, prolonged, and continuous skin-to-skin contact between the mother and father and their newborn low birth weight infant, both in hospital and after early discharge, with exclusive breastfeeding and proper follow-up. It can be commenced immediately after birth, has the potential to save hundreds of thousands of lives if started after birth, can be continued up till when the infant is 15 pounds, and the WHO recommend a minimum of 8 hours skin-to-skin care every day for babies. It was first developed in Bogota, Colombia in 1978 as an alternative to conventional care due to lack of resources, infant abandonment, and high rates of infection. Mums and dads' bodies were used as incubators to maintain the baby's body temperature, provide nutrition, and it provides appropriate stimulation. Skin-to-skin care should be provided for at least 2 hours minimum. It is possible to do with ventilated babies, and comfortable reclining chairs are recommended. Is it safe? Well, a variety of physiological parameters have been assessed to ascertain the safety of skin-to-skin for infants. We know that body temperature is maintained. The children do not show any increased episodes of apnea, and we do insist that guidelines are in place for single and two-person transfer. What are the benefits to skin care? We know that it reduces neonatal mortality in hospitalized infants, and that 40% number is actually increased by an additional 20% if skin care is started immediately after birth. Skin care reduces infection. It promotes self-regulation in the infants. It helps their sleep-wake cycle and arousal modulation. It helps maintain high levels of oxygen saturations, lowers airway resistance. Infants have fewer apneic episodes and have increased quiet sleep. It helps stabilize baby's temperature, heart rate, and respiratory rate. Babies have been shown to have reduced crying during painful procedures, and breast milk is readily available. And as we know, breast milk strengthens the baby's immune system. We know that skin care enhances bonding and attachment. It has a positive effect on the infant's cognitive development. It promotes more restful sleep. It has a positive effect on the motor development of infants, and it can reduce reflux. It has been demonstrated to shorten hospital stay, improve babies' immune function, and reduces their stress and physiological and behavioral pain responses. And babies who receive skin-to-skin care have increased weight gain. So what are the neurodevelopmental outcomes associated with skin-to-skin? Well, we know that infants who've received kangaroo mother care score higher on the Mental Developmental Index and Psychomotor Development Index of the Bailey Scale of Infant Development, both at 6 months and 1 year. We know that skin-to-skin care accelerates brain maturation in preterm babies, and it positively influences the premature brain network and synaptic efficacy up to adolescence. Infants cared for with skin-to-skin grow more quickly, and they establish physiological self-regulation more quickly. They gain more weight per day, and skin-to-skin increases sleep time, including time spent in quiet sleep. At term, infants who receive skin-to-skin in the neonatal unit demonstrate longer periods of quiet sleep and alert wakefulness, shorter periods of active sleep, and more organized sleep-wake cyclicity, suggesting more rapid development in state organization. Infants are also more alert and responsive and less irritable and fussy. The benefits of expressed breast milk include decreased incidence of infections and necrotizing enterocolitis, and improved growth and neurodevelopmental outcome. Skin-to-skin is associated with longer durations of breastfeeding, higher volumes of expressed breast milk, and higher exclusive breastfeeding rates. Mothers of skin-to-skin infants are more likely to be breastfeeding at discharge. Greater increases in weight gain through reduction of stress, stimulation of the digestive system, and warmth provided by the parenting results in the baby not having to burn fat or expend its own energy. Stimulation of mum's digestive system, which enables her to benefit more from her own nutrition and increases milk production. Skin-to-skin care through sensory stimuli such as touch, warmth, and odor is a powerful stimulant which releases maternal oxytocin. Skin-to-skin care lowers maternal stress levels. We know that oxytocin antagonizes the fight-flight effect, decreasing maternal anxiety and increasing calmness and social responsiveness. Skin-to-skin care outcomes for mothers suggest improved bonding and attachment, increased self-mastery and self-enhancement, resulting in increased confidence. And mothers who provide skin-to-skin describe feelings of being needed, increased confidence in knowing their infants, and a sense of their role as a mother. Parents who practice skin-to-skin are better able to interpret their infant cues. At discharge, parents were observed to look and touch their infant more frequently, show more positive effect, and be more adaptive to their infant's signals. And they provided a better home environment and were more sensitive to their infant. Skin-to-skin regulates baby's temperature, heart rate, and respiration rate. Mothers automatically provide thermal regulation by changing their own skin temperature to maintain optimal warmth without overheating the baby. The baby gains security and warmth by the close contact, familiar scent of mum, and the sound of her heartbeat, breathing, and voice, which offer gentle stimulation across the auditory, tactile, and vestibular sensory systems. Skin-to-skin can be used in pain management because it's safe, it's cost-effective, it's been demonstrated to reduce behavioural and physiological responses, and it can be used in a wide variety of settings. And it leads to a better tolerance of pain in preterm infants. When skin-to-skin is started in the first week of life, there's a reduction in neonatal mortality and increases the chance of the infant being colonised with maternal flora. What are the benefits for parents? They have an increased bonding and attachment, reduced maternal anxiety and depression, it increases parental sensitivity to infant cues, it builds parental confidence, competence, and satisfaction regarding their infant. Mums produce more breast milk, their breast milk duration is longer, and has been profoundly beneficial for adoptive parents. In 2022, the WHO made some recommendations with regard to kangaroo mother care, and the reports can be found on their website. The most demanding aspect of skin-to-skin care is the transfer. We can do it with one person, where mum directly lifts the baby from the incubator onto her chest, or two people where one of the staff on the unit can transfer the baby to mum. Either way, every unit should have a guideline with regards to both one-person transfer and two-people transfers. How do we support skin-to-skin care in our neonatal units? We need to provide evidence-based family material. We need to make sure that our staff are trained adequately to do both one-person and two-person transfers. Every unit must have a unit guideline and all staff should adhere to it. We need to make sure that we have comfortable seating for our families to do skin-to-skin. We need to make sure there's wraps and nests available. And above all, we need to support and encourage our families to engage in skin-to-skin care with their infants.